Good morning, students. Today is our topic is about the inflammation. Inflammation. Here, a slide in front of you that some of the common thing in all the words like appendicitis, arthritis, cholestasis, hepatitis, gastritis, ITS. ITIS means some kind of inflammation. So let begin with the topic inflammation. So inflammation, it is a typical pathological process which arises after damage of tissue and consists of three main vessel tissue compartments, or components like alteration, violation of the microcirculation, exudation or migration. We will talk about the exudate and transport in the later, and proliferation. Like it is, inflammation is a typical pathological process as common regularities which always are present and don't depend on the cause. Localization, species of an organism and its individuals features. So classification after the inflammation definition, classification is depending upon the clinical course, depending upon the manifestation of the clinical signs like acute, chronic, like hypergic and hypergic and normalgic, like depending upon the any stage like alternative, exudate and proliferate. Etiology. Force and duration of the agent influence should be stronger and adaptive possibilities of a tissue. The exogen means physical hard pressure on a tissue and lower temperature ionizing and ultraviolet rays and low barometric pressure. Chemical include the acid alkali salt of the heavy metals. Biological include the microorganisms, bacteria, virus, biotic agents, animal organism and worms. Antigens include the cholic acids, complex antigens, antibodies, hematoma, production of the intoxication. It is exogen and endogen. Stages: alteration, exudation, and proliferation. This is the alteration of the so stages of the inflammation include the alteration, exudation, and proliferation. Alterations means the changes during the inflammatory state, exudation, and the proliferation. So local signs include swelling, redness, heat, pain, and loss of function. These are the local signs by the cells and the gallon. So Roman physician Thales described the four signs: swelling, redness, heat, and pain. Greek physician Galen added the fifth one, the loss of function. So these are the structure of the cell, including the inflammation and the things is going under the condition of the inflammation. So general signs include fever, result from the one in influence of the thermoregulatory center excreted by the macrophages and the neutrophils. The leukocytes is a result of leukocytes outcome from the depot of the leukocytation and the proliferation. The protein of the acquired fast inflammation content increase in the blood on 50% by synthesis, mainly in liver. The ESR increase and the intoxication. Pathogens is, as I told you, it is a result of the pathological agent influence on a tissue. So damage of the tissue and the formation of the biological active substance are the main effect of the alteration. So mediators of the inflammation include it is the biological active substance which synthesize are excreted in the area of inflammation and conduce its progression, like humoral and cellular remain histamine, serotonin, monokines, prostaglandins, leukotrienes, and lysosomal enzymes. So histamines like vasodilation increase the permeability of the capillaries, activation of the leukocytes, mutation, stimulation of the phagocytosis, increase of the adhesive properties of the vessels of the ileum, and after that the pain. Interleukin 1, the muscle pain, joints pain, CNS, somnolence, liver, protein synthesis activation, thermoregulation, central macro circulation violations, the short time spasm of the vessel, the arterial hyperemia, the second is the venous hyperemia, the fourth stage is the peristalsis, and the fifth stage is the stasis. Exudation and the blood plasma penetration through the vessel wall and accumulation in the area of the injured tissues. It conduces swelling, pain, and loss of function. Exudation depends on the microcirculation violation because the hemoconcentration, aggregation of the erythrocytes and the platelets. But in time, while conditional microorganisms become worse. So exudation is like a plasma penetration through the vessel of and the wall of the accumulation in the injured area. Sometimes it may also cause the infection at that area. Mechanism of exudation: increasing the vessel permeability, increasing the hydrostatic pressure in the vessel, increasing the oncotic and the osmotic pressure, like the uh, pressure in the compartments, and inflammatory area, like the vascular pressure and the plasma protein pressure. Like vasodilation occurs, endothelial concentration, exudation. Exudation when the liquid is moved from outside of the compartment of the cell with rich plasma. Migration of the leukocyte stages and at staining penetration through the vessel wall. In most cases, acute inflammation, neutrophils migrate. The first process lasts 24 hours. In 24 to 48 hours, the monocytes emigrates most effectively. Lymphocytes emigrates a little bit later. Phagocytosis stage: approachment, attachment, ingestion, and digestion. It is called phagocytosis, the engulfing of the infection by the white blood cells. Cells inflammation, lymphocyte. It is macroscopic tissue macrophages. Type exudate: serous, fibrous, purulent, rotten, and hemorrhagic. Serous inflammation develop in the mucus and the serous membrane, interstitial tissue, skin, and the kidney glomes, capsules. The inflammation types according to the exudate: fibrinous, it contains the plenty of fibrinogen, which from the clots occurrence when an organism is affected by the Corynebacterium pneumococcus. It is yet such type of an inflammation occur mucus and a serous course more than often. Purulent inflammation, region of the staphylococcus. Purulent is exudate small but consists of many of the viable leukocytes and purulent bodies. It is characterized by the low pH. The the routing inflammation. Routing inflammation develops after the invasion of the routine. After the invasion means the blast of the cells in the microorganism to the purulent inflammation site. During this type of inflammation, necrosis of the injured tissues progresses. Inflammation area is not localized, and this provokes the penetration of the alien agent and toxic products in the vessel. The development of the intoxicants due to the which patient usually die. Hemorrhagic inflammation. Hemorrhagic inflammation as a form of the serous inflammation, fibrinous, one or more virulent one. So, in this kind of inflammation, it is characterized by the erythrocytes. So, in erythrocytes, impurity of the exudate like Siberian ulcer, natural smallpox, and influenza. So, it is like in proliferative phase, like the tissue regeneration is depend upon the interaction of the connective tissue cell between each other, interaction between the connective tissue and the fibrinous element, and the interaction of the connective tissue cell, blood cell, and the parenchymal cell. The granulous tissues. Young connective tissues with a lot of vessels, these tissues cover the wound and the ulcer. Skin defects it form during the damage of the mucous membrane and internal organs during the wounds, fracture, hematoma, congestion, necrosis, and all the things during the chronic inflammation. So function tests include the covering of defected trophy, macro, morphogenetic encapsulation, reconstruction. Thank you so much, guys.